Top 30 nursing MCQs. Which stage of a pressure ulcer is characterized by full thickness skin loss with visible fat but without exposed bone, tendon or muscle? Stage 1, Stage 2, Stage 3, Stage 4. The correct answer is option C, Stage 3. Which chromosomal defect is characterized by a missing or incomplete X chromosome in females? Down syndrome, Klinefelter syndrome, Turner syndrome, Edwards syndrome. The correct answer is option C, Turner syndrome. A nurse is administering digoxin to a patient with heart failure. Which assessment must be performed before giving the medication? Blood pressure, fecal pulse, respiratory rate, temperature. The correct answer is option B, fecal pulse. Which heart rhythm is life-threatening? Sinus tachycardia, atrial fibrillation, sinus bradycardia, ventricular fibrillation. The correct answer is option D, ventricular fibrillation. Which assessment finding is most concerning in a patient receiving a blood transfusion? Flushed skin, chills and fever, shortness of breath, headache. The correct answer is option C, shortness of breath. Which symptom is associated with Cushing's syndrome? Moon-shaped face, hyperpigmentation of the skin, excessive hair loss, weight loss. The correct answer is option A, moon-shaped face. Which lab value indicates dehydration? Decreased hematocrit, increased hematocrit, low sodium levels, low potassium levels. The correct answer is option B, increased hematocrit. What is the expected urine output for an adult per hour? 10 to 20 ml, 20 to 40 ml, 35 to 70 ml, 60 to 80 ml. The correct answer is option C, 35 to 70 ml. Which sign indicates shock? Tachycardia, hypertension, bradycardia, warm flushed skin. The correct answer is option A, tachycardia. What is the priority nursing intervention for a patient with a seizure? Restrain the patient, administer analgesics, offer fluids after the seizure, protect the airway. The correct answer is option D, protect the airway. Which clinical finding is associated with right-sided heart failure? Pulmonary edema, ascites, crackles in the lungs, none of these. The correct answer is option B, ascites. Which electrolyte imbalance is caused by diarrhea? Hyperkalemia, hyponatremia, hypercalcemia, hypernatremia. The correct answer is option B, hyponatremia. Which of the following factors is a common cause of atrial fibrillation? Mitral stenosis, aortic regurgitation, pulmonary embolism, ventricular septal defect. The correct answer is option A, mitral stenosis. Which position is used for a patient in shock? Supine, high Fowler's, Trendelenburg, lateral. The correct answer is option C, Trendelenburg. Which type of insulin has the fastest onset of action? Regular insulin, NPH insulin, long-acting insulin, rapid-acting insulin. The correct answer is option D, rapid-acting insulin. Which vital sign should be checked first in an unconscious patient? Temperature, blood pressure, respiratory rate, pulse. The correct answer is option C, respiratory rate. Which metabolic disturbance is most commonly seen in pyloric stenosis? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. The correct answer is option B, metabolic alkalosis. Which assessment finding is most indicative of hypervolemia? Crackles in the lungs, weak 3D pulse, decreased skin turgor, hypotension. The correct answer is option A, crackles in the lungs. Which condition is characterized by chest pain due to reduced blood flow? Arrhythmia, myocardial infarction, angina, aneurysm. The correct answer is option C, angina. Which of the following is a sign of dehydration? Increased urination, moist skin, high energy levels, dark yellow urine. The correct answer is option D, dark yellow urine. Which type of diet is recommended for a patient with chronic kidney disease? High protein, low potassium, high sodium, low carbohydrate. The correct answer is option B, low potassium. Which pulse site is located on the wrist? Radial, carotid, femoral, brachial. The correct answer is option A, radial. What is the first nursing action for a patient experiencing status epilepticus? Administer IV lorazepam, maintain an open airway, obtain an EEG, start cardiac monitoring. The correct answer is option B, maintain an open airway. A lipid profile test measures levels of blood glucose, hemoglobin, liver enzymes, lipids and cholesterol. The correct answer is option D, lipids and cholesterol. What is the most common early sign of hypoxia? Cyanosis, bradycardia, restlessness, decreased urine output. The correct answer is option C, restlessness. Which condition causes a collapsed lung? Pleural effusion, pneumothorax, atelectasis, bronchitis. The correct answer is option B, pneumothorax. Which electrolyte imbalance is seen in Addison's disease? Hypernatremia, hypokalemia, hyperkalemia, hypercalcemia. The correct answer is option C, hyperkalemia. The TSH test is used to evaluate liver function, thyroid function, kidney function, lung capacity. The correct answer is option B, thyroid function. Which vital signs is most critical to monitor in a patient with a suspected stroke? Respiratory rate, temperature, blood pressure, heart rate. The correct answer is option C, blood pressure. What are the main characteristics of Klinefelter syndrome? Occurs in males with an extra X chromosome, infertility due to underdeveloped testes, taller than average height, reduced facial and body hair. The correct answer is option E, all of the above. Thanks for watching. Subscribe to the channel for the latest informative MCQs.